Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. Hello everyone, this is Dr. Kaveh, Stanford and Harvard-trained anesthesiologist and integrative medicine specialist, and I practice medicine sometimes a little differently than how the healthcare system wants doctors to practice. And that's by giving patients the compassion and respect that they deserve when they put the trust of their lives in our hands, whether in the operating room under anesthesia or in a vulnerable psychedelic medicine experience. So let's jump right to it. Here are 5 tips that I encourage all of my patients to embrace when they're under anesthesia or having a psychedelic experience so they can better understand their mental health and be aware of where they are in that mind-body connection that can lead them to tap into their healing potential or can lead them into a spiral where the mind can hurt our bodily health. So let's start with number 1, which is how the body opens up like a book when we're under anesthesia. I'm actually going to show you a video of what that looks like in that vulnerable moment there. You see me here actually helping a patient go under anesthesia. You can see the propofol in my right hand. You can see me speaking with that patient there as they're going off to sleep. And then the breathing tube will eventually go in once they're fully asleep. But in that moment, when patients are falling asleep, like you see here, their body does all sorts of fascinating things. If you look at the monitor behind me, you'll see that we're monitoring your heart rate, your EKG, your pulse oximeter, your breathing patterns, and so much more. And all of these can change under anesthesia based on where your mental health is. This is a case of general anesthesia, but even under sedation, the effects can be more pronounced as anesthesia or a psychedelic experience turns off the prefrontal cortex and the parts of our brain that ordinarily prevent us from doing things and saying things that we would do. Our body opens up in ways that we see on the monitors and on ways that patients can experience on their own. So when we can guide a patient sometimes to verbalize what they're feeling, what they're experiencing in that moment, especially if it's a case of sedation, either with propofol or if it's with a ketamine infusion like in my clinic or in the operating room, we can recognize what made us sick in the first place. And often this is from rigid mindsets and rigid behavioral patterns. May not have led to the reason that we came into the operating room, but may have led to the comorbid depression or anxiety. Now, under anesthesia, your body tells us more things, especially whether there have been substances used to self-medicate from those conditions or the other medications that are used like antidepressants, pain medications, anti-anxiety medications. And that leads us to number 2, way that we can recognize where our mental health is under these types of altered consciousness, these states of altered consciousness. And these will all play into, at the end I'll explain, ways that we can tap into our inner healing potential, but we have to recognize where our mental health is first. So like I said, when we're in that disinhibited state, we're sometimes more honest with ourselves from the anesthesia's effect on our brain by disrupting what we call the default mode network. So number 2 is that our habits can also be exposed. Habits meaning things like hyperventilating when we're anxious, or having almost OCD-like behaviors, like fidgeting, having to touch parts of our body, or speaking. So many patients have their coping mechanism be chit-chatting and chatting and talking. Sometimes they reveal things about themselves, about what the underlying causes of their anxiety are, but also just sometimes speaking to fill the void, which raises the question of why are we afraid of emptiness? These represent mental habit loops that we can be in all the time, but under anesthesia, we can look at our habit loops from a different perspective. And that different perspective can help us recognize what we call TBR loops, which have profound implications for our self-healing. And that's number 3. TBR loops. That stands for trigger, behavior, and reward. TBR loops. So let me show you another video here of a patient who is going under anesthesia and what this TBR loops actually mean. So take a look at this case here. This patient has fallen asleep. It can be either a case of sedation or it can be general anesthesia. Let's see. As this patient here is in their sedated state, they respond to their environment still, depending on how deep they are. Now, I've obviously blurred the patient out here, but you can't see my mouth moving, but I'm chatting with them as I'm preparing things with the anesthesia there. And sometimes patients in this state begin to go into a TBR loop from a lack of control. So let's break that down. The trigger in these patients is not being in control in the form of not seeing what's going on because maybe the surgery is on their leg and they're flat on a table and can't see their leg. Maybe it's something that they can hear but can't see. Maybe it's something that they can't feel but they can hear, like if you have a spinal or an epidural. Regardless of how you get there, these are all examples of losing control. And when we lose control, the most common behavioral loop, the behavior in that B, we said the trigger was losing control. The B behavior is trying to regain control. And in these states, when our brain is in an altered state of consciousness, we can reveal a pathological or a diseased or a not helpful behavior, which often also exists in real life, but we just don't appreciate it because of the perspective that we're looking at ourselves in. So let me give you a concrete example. We'll close this video there. Oftentimes when patients can't see what's going on, the trigger causes them to feel anxious and maybe freak out. I don't mean freak out in a I'm not belittling this. This can be very serious, but it causes them to try to regain control. That's the behavior. But how we try to regain control isn't always safe or healthy. Some patients, like we said earlier, begin to talk to fill the void. They might begin to move and fidget, and that can be dangerous in the operating room. In some cases, they'll go into a panic attack, which will raise their heart rate, cause their palms to get sweaty, raise their blood pressure, and it's actually a way of getting in control of your body. You're mobilizing the glucose that's being converted out of your liver. You're putting your body in fight or flight mode. So even though it sounds horrible, it's actually a way of you getting in control in a time when you're not in control. That's the behavior. The trigger was losing control. The behavior is your body trying to regain control, even if it's a pathologic or a harmful way of doing so. The reward in all this is kind of perverse or twisted, if you will, and it's a little dopamine rush that comes to your brain. So this leads to a loop because you feel like you're out of control. Your body does something to regain control, even if it's not meaningful control. And the reward is a little bit of dopamine. And you're still not in control, so you try to gain control again, and you get a little bit more dopamine, so you end up getting a loop. That's what we call a TBR loop. It's almost addictive. Kind of sounds like an OCD loop. Imagine somebody who sees their hands, feels there's germs on there, has to wash them, gets a little bit of satisfaction from relieving that compulsion, and does it again and again and again. It's not too different from all of us. We all have the potential to manifest these habit loops, and they can come out under anesthesia, and we can observe them from a different perspective, especially if it's in a guided psychedelic experience. That's why I call my patients the night before surgery. It's why, like I said at the beginning, we have to give our patients the compassion and dignity that they need, not only that they deserve for them trusting us with their lives, but also that they deserve in this vulnerable moment, in this vulnerable period, in the operating room or in a psychedelic experience when they're exposed and vulnerable to us. So that takes us to number 4. What happens when patients come out of the operating room or come out of a psychedelic experience and they still have ongoing concerns, which especially after surgery, big one is going to be pain or nausea or maybe not feeling in control or feeling emotional. Number 4, how we can be aware of our mental health awareness, so we can begin to heal ourselves, is where do we seek control in those moments when we're panicked, in a vulnerable state, coming out of an altered state of consciousness. There's really only two ways your brain can move. There's a fork in the road. You can either look for an external locus of control or an internal locus of control. What does this mean? An external locus of control is looking outside your body. Maybe for a pill. So you're in pain, the first thing your brain goes to is, I need a Norco, I need a pain medication right now. The other fork is an internal locus of control. So in some patients, not all, that comes out as, I'm noticing the feeling that my knee is throbbing after surgery. Why? What am I experiencing? You see how the default response, the reaction, isn't looking outside for a pill. It's looking outside with a sense of curiosity, like asking what happened. What part of the surgery caused this? Is this throbbing something that I should be concerned about? Is this throbbing part of the natural healing process of my knee? Is this the body trying to heal itself? And I'm experiencing this as pain, but I'm not saying you shouldn't treat the pain, but recognizing the purpose that it serves helps empower patients to tap into their inner healing potential once again. So that's number 4. You can recognize, what is your reaction? Are you looking inside or looking outside? And when we're in this vulnerable, exposed, altered state of consciousness, because hey, after surgery, the anesthesia sticks around for at least half an hour or so, maybe an hour. It depends on the type of surgery, depends on the type of anesthesia, but it's going to be around there for a little bit of time. And you can still take advantage of having a different perspective on the experience that your body's having. Well, that leads us to number 5, because what happens to your brain and your mind when you have a bad experience in this altered state of consciousness? So yeah, I'm talking about maybe a bad trip, maybe a nightmare under anesthesia, maybe reliving something in the operating room that causes you to wake up with panic or anxiety. What is the reaction, the gut reaction that first, before your mind has a chance to cover up what's really going on? In this altered state of consciousness, the first reaction comes out for your provider to see, your doctor to see, provided that they're looking for it. Because if we're just focusing on something else, which sometimes we need to, we have to focus on transfusing blood or making sure you're not on laryngospasm. There's many things that we need to do as you're waking up from anesthesia. But if it's the right case and everything else is safe, we can look more closely at the patient. Are they saying something? Are they moving in a particular way that's maybe trying to guard somewhere where they've had a PTSD experience before? Maybe it's somewhere in the pelvic area. Maybe it's somewhere in their chest or their breast area. Maybe it's in their arm. What are they saying? Where are they looking? What are they doing? You can't always tell, but you can always give your patient the compassion and the respect and the dignity, and recognizing the sanctity of that moment when they're so vulnerable. And the least we can do is at least respect that and empower them to recognize, what is their brain doing? So when you have this bad experience, what is the reaction to it? Is it one recognizing that I'm surrounded by people that care about me, that I can trust, that are here to make sure that I'm safe no matter what happens, medically or mindfully? Or is it one that is external locus of control, once again looking for, oh my gosh, I am freaking out, I'm having this PTSD experience, which is very real. We're not downplaying any of this at all, but not as aware of the surrounding of compassion, of love, recognizing that I am in a safe place. Sometimes when we've been scarred so badly, especially in medical settings, we jump straight to the conclusion that I'm in this alone, there's no one else but me, I am in trouble, I need to enter fight or flight mode, and I need to do it now. Well, that leads to nightmares becoming worse after anesthesia, bad trips spiraling out of control, not being able to learn a lesson from what that experience might be trying to show us, not embracing the compassion of those around us, the connectedness we have with other people. Of course, this can be difficult to do if you're in pain, if you're hypoxic, if there is a complication from the surgery, or a bad trip that really dug deep and went under your skin. And we appreciate that that can absolutely happen. But remembering that hopefully you're surrounded in that cocoon, literally smothered in a connection with those around you, in a healing space that your doctor is trying to provide for you, can often offset so much of those bad outcomes from becoming worse after you wake up, after the experience is over. And recognizing where we default go to in that vulnerable state gives us a powerful insight into our mental health. Being aware of our mental health so that we can look back on this experience and ask, how can we be better? How can we do better for ourselves? And often gratitude is powerful, gratitude for ourselves and gratitude for those who are guiding us in these experiences. So there you have it, 5 tips to how you can gain more awareness about your mental health in anesthesia experiences and under psychedelic medicine experiences, medically supervised, that is. If you learned something, I would appreciate it if you hit that like button. I don't do ad placement. I depend on support from watchers like you to learn more about your body, and remember that you have more power over your health than you've probably ever been told. Until next time.